Everybody, my informational speech is going to be on home health and what you know about it. If you were sick or injured and needed to stay in the hospital or didn't need to stay in the hospital and didn't need round-the-clock care, but you needed someone to teach you medicine usage, therapy appointments, but didn't want to leave your home, that's where home health comes in. Why not a skilled nursing facility or a rehab? Well, if you had surgery or an illness and you weren't strong enough to walk or get out of bed, and you needed round-the-clock care, that's a facility. And a facility, they monitor medication usage, they give you antibiotic injections if needed, wound care if it's deep enough and it can't heal. And also, if you needed palliative care or end-of-life care, that would be hospice. Hospice has goals to make the remaining days of your life better. They have the staff as far as like a social work that helps planning for that, and then they have a chaplain. And here are the hints of it. So if you really want that home health care, you want the skilled nursing, you want therapy to come to you, that's where home health comes in. So home health has grown over the last decade or so. In 2012, the U.S. spent over $77 billion on home health, which doubled since 2001. One reason for the growth is because CMS and which is Medicare and Medicaid, came together and decided to start with quality of care, which pretty much means in 30 days from a patient being sent home, they started dinging the hospitals if they got rehospitalized. So it was for things like heart failure, surgical infection, pneumonia, or myocardial infarction. So that has been a big thing, and they've put case managers in now to kind of monitor that and place the patients in the correct facility if needed. So in home health, your nursing comes out to get you started, and whenever they come out, the initial evaluation, they set you up on the identifying any kind of knowledgeable deficits you have as far as your medication, if you have wound care, so they can teach you. And it's all about teaching to where you're able to live the quality of life that you want to live or are able to within reason. So the first thing they do is they identify all your deficits. They establish goals as far as you setting up your medications and taking them every day, or if you needed trouble, if you had a wound vac and you needed help troubleshooting it, they can help you with that. They help with teaching wound care, medication, urinary needs, and disease processes. Once everything is set up, then it's all about the education of goals and confirmation of your understanding and that of your family members. Then it goes into PT, which follows that, or any therapies, PT, OT, and speech. They come out and evaluate, they set up the goals, they see if you need any kind of durable medical equipment, and they also set up an evaluation of goals. They set up an exercise regimen for you to follow, which is very useful if you want to shower by yourself, if you want to drive, that type stuff. And then inside the home health, you always have the people working as far as like your scheduler, setting up all your appointments, making sure that you have everything that the doctors have ordered. You have orders management that is following and all those orders, making sure that they're signed so Medicare will pay. You have your administrator who watches over everything, making sure that you have marketers out working, and then you have your DON who is monitoring over all the nurse care. And then last but not least, you have your case conferences where all the disciplines get together and they go over all your care, making sure that there's nothing that you missed or nothing that they missed as far as medicines, if there's a decline in anything that you have, as far as if you have a wound and that declines. They make sure that it's noted. They make sure that your doctor's called. They have everything right then and there. And they usually meet about once a month or so. So, in conclusion, knowing the difference between the skilled nursing facilities, hospice, and home health, remembering what the nursing and the PT staff can do for you, and also how the industry's growing, and knowing that there's people there out there working for you to get you where you need to be or where your goals are. So in case one day that you and your family need it, now you know what we do and what we're there for. Thank you.